Good afternoon, everyone. It's afternoon in Nigeria, 2:30 p.m. Um, I've been introduced as Olajumoke, and you can call me Jimmy. Thank you very much to the organizers of this conference. Thank you. It's such an honor and privilege to sit with all the brilliant minds on this platform today. Thank you so much for having me. And I will be speaking on the topic COVID-19 experience in Nigeria, Africa, because Nigeria is located in the west of Africa. And I must also thank the organizers for coming up with such a apt team for such a time like this. And despite all the shakiness we have experienced as professionals, as a profession, you still thought about this to make this available to our colleagues, nursing in times of the pandemic and renewing the essence of caring and caring for professionals. Thank you very much. I bring you greetings from my university, Lagos State University in Lagos, Nigeria, and where I serve as a lecturer. This is my outline. I'll just move in. Okay, so briefly to talk about the African experience. To talk about the African experience, WHO has stated that we have more than 2 million confirmed COVID-19 cases on the African continent, with about 1.7 million recoveries, which is quite encouraging, at least not like we have it in other climes. But we have up to about 48,000 deaths cumulatively as a continent, with South Africa leading the list, Algeria being next, and Kenya third. So Nigeria is not even in the top three. However, we still have our issues. Yeah, and that's what we are going to listen to this afternoon. And so this is just to give you a perspective to it. Nigeria is located in West Africa, and we have a teeming population of 206 million. I don't know how many countries put together I would call that in some other climes. So we have 206 million people in this country, and that made us the most populous country in Africa and the seventh most populous in the world. And Lagos, of this 206 million, Lagos, Nigeria, where I am streaming this event from, where I'm speaking from, has about 23 million. Lagos alone, as a state in Nigeria, has about 23 million people. And Nigeria is a multinational state, and we have over about 250 ethnic groups, and we have about 500 diverse language in this country. Another important thing to note about Nigeria is our economy is the largest in Africa. Yes, and you see that. Our index case was confirmed on the 28th of February 2020, even though the pandemic has been around since December 2019. So we confirmed our first case in Nigeria 28th of February through an Italian citizen who works in Nigeria and came into Lagos on the 25th, and at 28th we had confirmed our first case. And this is talking about Lagos, Nigeria, where we discovered our first case in Nigeria, and it still remains the epicenter of the pandemic in Nigeria till date. You would see from the slides ahead. And what did we do as a country? So we had different responses, but this was centrally coordinated by the Nigeria Center for Disease Control that had to coordinate all the sectors together and raise the task force, a presidential task force, a state task force. So Nigeria has about 36 states. We have 36 states. These 209 million people are across 36 states. And of course, they activated the National Emergency Operations Center, who was working closely with Lagos State Health, where the virus was first picked. And this is a snapshot of what the situation is as at today in Nigeria. You can see that Lagos still remains the epicenter. This is data for today, 27th of November. And Lagos, out of the 37 states in Nigeria, still has the highest number so far. So as at yesterday, we had 169 new cases, and we have confirmed a total of just 66,009, almost 67,000. From all our isolation centers, treatment centers, we have discharged up to 62,585 of the 66,000 cases we have confirmed, and we have about 1,169 deaths so far. Even at that, the death has been like, people have been like, really? You mean this COVID is real? Simply because we have that number compared to what we have in other climes of the world. All right, so COVID-19 in Nigeria, like it's a pandemic, it has caused so many governmental changes, societal challenges across the world, including Nigeria. In fact, there was a saying when the pandemic started, or when Nigeria discovered its first case, that we dare not discover it in Nigeria, or we dare not have cases or an outbreak in Nigeria, because the situation might look, we might not be able to manage it as a nation. We might not be able to manage it as a nation, sorry. And it has caused a lot of challenges for us as a nation. And in Nigeria, the response to this pandemic is on top of a healthcare system that has experienced previous infectious disease outbreaks, but in the context of a scarce resources that is typical to many low and middle income country, of which Nigeria belongs to. Nigeria is a low middle income country. And this is riding on top of the back of a stretched, overstressed healthcare system. And of course, the pandemic disrupted the delivery of essential services, including routine immunization in Nigeria. And of course, that left some of this vulnerable population more vulnerable, if I could put it that way. And our response as a nation, like I said, was on a weak and poorly funded healthcare system, poor infrastructure, inadequate manpower, absence of training of healthcare workers, and capacity building amongst other issues. And that was why we were like, we do not know how we're going to manage this as a nation if we dare have an outbreak. But let's move on. Yeah. So what does this mean for a Nigerian nurse? Of course, when we had our first case, people were like, would I stop working? What is this? I do not understand this. We do not understand the management. There were conflicting lines of instructions here and there, and as caregivers, the most important thing I would like to, that I witnessed and I saw played out with a lot of our colleagues across the nation, is nurses had to look beyond the task of nursing. We had to be more humane because the task of nursing wasn't cutting it anymore. It wasn't doing the job. So we had to be more humane, especially because everybody was confused. There was anxiety. Consider the spirituality. We had to do more listening. That was what it meant for the Nigerian nurse, because, of course, it was a viral infection. We were not sure about the treatment lines, management lines, and people just had to listen more. We had to listen more. Clients and patients demanded for more, especially their psychosocial demands. And of course, nurses had to acquire more knowledge and skills to meet these demands, not just their day-to-day practice. And the demands did not just increase. I have to state that it expanded. It expanded completely for us, not just in Nigeria, across the world. Nurses had to go beyond just giving the drugs, and they had to touch the clients on the levels that it meant anything to them. That was it. And in their response to this demand, they realized that they needed more care for themselves to meet the changing demands of patients and clients. Of course, they were giving out so much. And I liked the first presentation we had yesterday. I think that was Mary White, if I got the name correctly, from NHS UK. And she talked about burnout, and there is no better explanation for that. It was just exactly the way it was experienced here. And for the nurses, this meant we had varying levels of fear, anxiety. I had colleagues who had to stop working. They had to stop working. They felt their families were young. There were so many unsure things in the system, like no insurance and things like that. So people had to first of all stop working. A number of them, you know, some people who had their leaves due at the time had to take it. Like, okay, let me get away for 30 days, 42 days, and let's see how this pans out. All right. And in the initial period, there was complete lack of protocols, identification protocols, management protocols of COVID cases. And when we started having some protocols, there were confusion. So some of the things and that was when we started getting infections amongst the healthcare workers, including nurses, alarming levels of burnout among nurses and other healthcare workers, inadequate workplace safety. Yeah, that happened a lot. Nothing really changed in the workplace environment. It wasn't like because COVID came, something changed drastically in the work situation. It did not happen that way, you know. Lack of social insurance policy was obvious, and nurses and other healthcare workers kept demanding for this. There was impossible work schedules, especially when we had lockdown in Nigeria. We had the lockdown at about 2 weeks after we identified our first case. And that meant that there wasn't public transportation. Not too many people had their cars to drive, and of course could not meet with the shifts, their work schedules, and that affected nurses as well. Then we got the big blow, as in, you know, like, okay, I can still come to work, do my work. I'm just probably overstretched. But we got the big blow of the gross shortage of PPE at all the healthcare facilities, whether the primary, secondary, and tertiary. For the longest time, Nigeria had actually depended on importing PPE for the longest time. So, and of course, because borders were short, international airspaces were short, we had that gross shortage. And this led to nurses getting infected. Some of them got infected, they got tested, and some had to pay for their own treatment. It was that bad in the initial period. It was that bad. They had to conduct investigations at their own cost. We lost some of these people. At least I think about now we've lost about 200 nurses, not just healthcare workers, but nurses, and a larger number infected, So some healthcare workers are still being owed salaries, as entitlements and things like that. Student nurses missed out of the whole experience. Yeah, because they were withdrawn from all the clinical areas across the country due to a circular released by the Nursing and Midwifery Council of Nigeria, because it was obvious that we had shortage of PPE. Yeah, we had shortage of PPE, and we could not guarantee the student nurses' safety. We could not, even the healthcare workers, the registered nurses, their safety were not guaranteed, quote and unquote. And so we had to, of course, parents cried out, what's going to happen, in the hostel and all of that. So students were allowed to return home. And that's a very, very, that's very peculiar for me, because as an educator, I think the pandemic was a rare opportunity, a lifetime learning opportunity for student nurses. So up until now, in the last 20 years, I got into the nursing profession. I have never witnessed a pandemic. And many more, most of us on this call today might not have that opportunity of witnessing a pandemic, particularly in the profession while practicing. So I see that as a lot of missing out. It was a lot of missing out. Whereas we should have leveraged on such an opportunity for student nurses to learn, those preparedness skills, response skills, how to manage pandemics that they may not see again, in a very long time to come. Moving on, what was the impact of this pandemic on us as a nation? Obviously, we locked down like every other nation of the world, and but the lockdown came with the fear of survival because over 60 of majority of Nigerians live on less than $2 a day, and people have to work to eat. People have to work on daily basis to get something to take care of their families. And so, of course, the fear of survival came in terms of feeding, basic sustenance for the populace. That left our vulnerable populations to become more at risk. Pregnant women couldn't access their antenatal care, post betting clients couldn't get support persons in labor or instance, people who had to cater for their elderly ones from their meager income. And this income had stopped because of the lockdown. You can see how that affected us. Please, can you confirm if you can hear me and you can still see me? All right, thank you. I could just go back. So I'm still talking about the impact of the pandemic on us as a nation. So the lockdown happened that came with fears of survival. This situation left our vulnerable populations more at risk. We lost quite a lot of our elderly because they didn't get the care they needed. And of course, we ran out of test kits during this period, a scarcity period of PPE, like I said, and but this was closely followed by local production. We had to start producing locally. Another impact of the pandemic on the nation was the stigmatization of the disease. Of course, the stigmatization started with the healthcare workers first, nurses, doctors, and all of that. And of course, in their community, people looked at them strangely, like, don't tell me you are coming from the hospital. Don't tell me you saw a COVID case. I mean, like, that happened. Not to talk of people who suffered the disease or who got infected with COVID and got treated, went to the isolation center, came back, and people stigmatized them. And that happened, that continued for a while. Like, oh, they say this thing, you can't talk to anybody, you cannot live with them in the same community anymore, and all of that. So the stigmatization part of it was there. And what was the response? I mentioned in my previous slide that we had local productions of PPE, and of course, that was some kind of socioeconomic boost to a sector of the economy. There was rigorous training and retraining of healthcare personnel. At the time, because some people had to go off work and reducing the number of people on the front line. There was a temporary recruitment. It was temporary. Some of them were given 3 months appointments to work because the government was saying they could not employ permanent, they couldn't give permanent employment. So we had temporary recruitment. There were replacement of nurses, and this was riding on the back of a massive exodus of Nigerian nurses and healthcare workers, you know. So welfare packages to the healthcare workers, we had some, but though not very encouraging because now that people had to work 24 hours, 48 hours, they had to provide food for them. Of course, they couldn't go anywhere, but it wasn't very encouraging. They cried out, and we had some kind of protests, to that effect. Then some adjustment came. There was training, equitable distribution of healthcare worker, especially at the primary healthcare levels, because like 2 months into the pandemic, or 2 months into our first case in Nigeria, we started anticipating the community transmission phase, which was the most scary part for us because we are in a densely populated state like Lagos, Nigeria. We said we're about 23 million in Lagos alone, which is like, I don't know, the population of how many countries put together. And then 209 million in Nigeria. We're like, oh God, the centers are not as equipped, the isolation centers, the treatment centers. How are we going to manage this? Of course, the government had to swift into training and distribution of healthcare workers, especially at the primary health center level, and that helped a lot. There was massive public health education advocacy messages going on, social media, traditional media, and at all levels. That helped a lot. Advertisement, jingles, and people had to, interpreted in so many local languages. I said we have about 500 local languages in Nigeria, and that helped a lot. That massive public health education advocacy went a long way. So where are we today as a nation? So lockdown has been eased completely. I think we were home for about 7 months, from March to about August. Partial lockdown was eased, but right now, as I speak, lockdown has been eased completely. And trust me, people are getting fatigued and relaxed, like everything is over. People have ignored safety protocols. However, as a nation, because our cases have reduced significantly from the chart I showed earlier, um, we're already thinking of the second wave of the pandemic. And like, because we're a very religious country, people were like, oh no, we're not going to experience it. No, God will not allow us to see that as a nation. But of course, there was no amount of prayers or whatever that prevented the first case from coming in. So, like other nations of the world have experienced a second wave, we're beginning to think about it. Training has significantly improved, and there's more clarity in terms of identification, management of COVID cases, because that affected a lot of nurses because they were the first point of call at every center in all facilities. They were the first point of call, but they struggled with identification and management even before they move the person to a testing center or something like that. So, but that has significantly improved. And equipping of the healthcare facilities um, has not improved so much. Yes, but PPE has improved a whole lot now. In conclusion, I begin to close this. COVID-19 has exposed the Nigeria's wobbling healthcare system, the crisis within the health sector, but still, the health workers are battling to curtail the spread of this virus. On top of other issues, other healthcare outbreak or other outbreaks we have as a nation, like yellow fever at the moment, and we have to start the yellow fever immunization that had been on hold across all immunizations anyway, not just yellow fever. But for instance, we need to start the yellow fever immunization immediately, so that we don't have an outbreak. Um, we also we're intensifying public health awareness about the second wave, helping people to understand that there's something called second wave, because even though the curve was seriously flattened and we got to a stage where we had zero cases, we are now having a few cases again, and then telling people about the second wave, warning the populace, because we do not want a situation where the virus mutates into a more virulent form. The challenges of testing and infrastructure. With all these challenges, I think Nigeria as a nation has recorded a huge success, because we have a high rate of discharge from our isolation centers across the nation. And the mortality rate is so low. Again, we have 1,000, just a little over 1,000. Compared to some developed economies, I would also say that resilience as a trait has helped nurses for the most part. And we have a prayer as nurses. And I'm sure this is also the voice of nurses all over the world, that may this year be our year, the year that our voice is empowered and dignified. And one thing is certain, that posterity will never forget the contributions of our dear nurses and other healthcare workers globally in salvaging mankind from this extinction that could have happened in the course of one of the worst pandemics that have ever bet on the shores of humanity. Thank you very much. Thank you for your time. Thank you so much for having me on this platform. I have learned as much as you have learned. I have been listening in since yesterday, and it's been just amazing. Thank you very much.